What underlies this passion for healthcare?
Thank you, Brenda. I mean, if I look back my childhood, my mom, my dad,
Hmm.
and even at the childhood, Brenda, I always had passion to create things.
Okay.
Um, and I would get immense pleasure if what I have created is used by someone. And that someone can be a small group, it doesn't need to be big. So
Okay.
that at the childhood level. So when I came here through my supply chain projects, I got into a company called Medtronic. It's a large medical device company.
Hmm.
And there I got a really big exposure to healthcare. Learned a lot. Um, Found that in US we spend $2.3 trillion total per year. Out of that, approximately 800 billion is based in
With a
healthcare.
B,
B,
right?
not M,
800
is
billion.
B. And this is per year. This is not one time.
Right.
And and in a very small way, I felt the products or solutions we are creating or designing, if we can make even a small difference in reducing that waste while making an impact to the human life, why not? And that really solidify my career, my
Hmm.
passion to be remain in healthcare. And if I wanted to be in healthcare, I wanted to know the details of it and all the angles of healthcare.
Right.
So while working for Medtronic, I got a lot of exposure to hospitals and clinics. So I felt if we are selling our product and services to hospital and clinic, I want to work inside the hospital and clinic.
And how did that go?
So it went really well. So I joined a group called Facey Medical, which is part of Providence Health
Yes.
and Services. And learned a lot, by the way, how a
Hmm.
physician operates, what's really important to the patient, what is really important to hospital. Um, and that gave me a lot of exposure and also the appreciation for patient care, by the way.
Okay.
Um, because at the end of the day, anything we do in healthcare is really important to how it's impacting to the patient care.
Absolutely.
And healthcare is the only industry, Brenda,
Hmm.
where if you improve the quality, you reduce the cost. That's the
Yeah.
only industry. If you go
Say
in
that
hotel,
again. Say that again. That's
if you
very
go
important.
if you go in hotel, for example, if you
Hmm.
buy a 5 star, you pay more, am I right?
Hmm. That's right.
But in healthcare, you improve the quality, the cost goes down. That's the only industry, by the way.
Hmm.
It's very fascinating. So learn a lot about the wider side, which is the hospital clinic. And then I felt for all this, someone is paying. And yes, patient pays a portion in US, but the health plans are the one which are paying majority of our US healthcare cost. So I said, I need to go to the work for a health plan.
And there's
To know,
and crack the code for CPT codes and all that.
exactly
Right.
ICD and CPT and claims. So I went to work for a company called New Century Health. Um, and there I learned a lot about risk contracts and how we manage the provider, what
Okay.
is really important to the claims, how we do the utilization management. So learn a lot about um, um, how the payment system in US healthcare works. Um, so, and then of course the company Follow My Health. Um, I got a lot of exposure about patient size
Right.
because at the end, whatever we are doing, either from life sciences or hospital, clinic, or health plan,
Hmm.
it's really impacting the patient in the end. So I feel privileged and somewhat lucky, Brenda,
Bet you.
to work in all the facet of healthcare system in the
Affecting patients' lives one by
US.
one.